Hello, I'm Professor Doctor Meriç Karacan, broadcasting from Turkey, Istanbul. Now you're looking at the Bosphorus, the other part. We are in the European part now, and just across the Bosphorus is an Asian part. Istanbul is a lovely city, so we all like you to visit Istanbul one day. My friends have gathered some questions regarding infertility, the new recent developments in the field of IVF in vitro fertilization. I'm going to try to answer all these questions today. I'm going to get one of these papers and answer the question. I hope it will help you out get more information on infertility. So the first question is, should I avoid some food before IVF treatment? Yeah, good question. Actually, there is no specific food to be away from. However, you gotta be away from fatty or high-calorie food. Avoid from high-calorie intake because excessive body weight is a negative sign or has a negative impact on the implantation and the live birth rate through IVF. Try to be having normal body mass index. Otherwise, excessive fat tissue create a harmful environment for the hormones used and the embryo. So please try to be on a healthy diet and try to get into a normal body weight. It's going to be helpful. Now I'm going to pick up the second question. Right. The second question is, should I have a specific diet? As I mentioned, a healthy diet is the most prominent diet. So, for instance, Mediterranean diet or low-calorie intake, abundant of vegetables and salads rather than fatty or processed food should be preferred to get a better body weight. If you get your ideal body weight, make sure it's going to be helpful for us to get the best out of your ovaries, because in case of excessive body weight, the dose of medications used to stimulate ovaries is increased, the cost is increased, pregnancy rate drops. So please pay attention to your diet and lifestyle prior to IVF treatment. All right, now let's pick up the third question. All right, now the third one. When we can start the treatment? We usually start IVF treatment on menstrual cycle day 2 or 3. This is the beginning of follicular development. So we like to catch the first phase of follicular development. So if you like to go through IVF, please go see your doctor before the menses, before the period, and then we usually start using medication to stimulate follicles on cycle day 2 or 3 while the follicles are ready to be grown. And the next question is, can I start even in my country, rather than coming to Turkey? Yes, particularly in the first 4 or 5 days of your cycle, you can use this medication in your country. And first visit can be done, first examination can be performed in your country by your physician, and maybe the second examination after the use of these medications for 4 to 5 days, the second examination can be done in your country. So this approach might shorten the duration of time for you to spend in Turkey. The next question is, how many days does the treatment take? IVF treatment usually takes 18 to 20 days from the beginning of the cycle, like from the first day of cycle till the day of embryo transfer. So approximately 18 to 20 days. All right, can I still do IVF at the age of 44? So we know that age has an enormous impact on egg quality and subsequently embryo quality. Particularly over the age of 40, the egg quality drops significantly. So if you like to have a child, please do not postpone your dreams. Try to get medical care as soon as possible. At the age of 44, yes, it is still possible to have a child, to get pregnant. However, pregnancy rate each cycle in a cycle of IVF is about like 2 to 3% at the age of 44. It is 35% or 40% at the age of 35, and almost 50% in a woman at the age of 30. Please try to go through IVF at an ideal age. Do not postpone your plans above the age of 42 or 43. All right, can I work after embryo transfer? Yes, absolutely you can. We don't keep our patients in bed for like 4 or 5 hours after the embryo transfer. You just stay in bed half an hour or for an hour, then you can get back to work. According to the recent studies, there is no need to stay in bed for a long time. So you can get back to work, get back to routine life, normal life, an hour after the embryo transfer. What is success rate of IVF? So it depends. It depends mainly on woman's age. It's a very good predictor of pregnancy rate. If a woman is 35 and younger, we have a pregnancy rate of 50% per cycle. If it's older than between 35 to 40, it drops down to 40%. Then at the age of 40, almost 25-30%. At the age of 44, it goes down to 1 to 2%. So please do not postpone your plans. And the next question, can my husband come just for a couple of days? Yes, absolutely he can, because we need to get his sperm right away. So we can start your treatment over here in Turkey, in Istanbul, and as your follicles get ready, your husband can come visit us just before the day of egg collection, so that we can get his sperm on the day of egg collection and he can get back to his country. So 1 or 2 days is enough for men, whereas women should stay in Turkey for 18 to 20 days. Sorry about that. Next question, do you provide accommodation? Yes, we have friends, we have colleagues here who can provide you with necessary accommodation. So don't worry, don't hesitate to contact them regarding your accommodation. We have many patients coming from abroad, so we have a very experienced team, colleagues in providing this accommodation. So don't worry, they'll get you the best option available in Turkey. What should I pay attention to after egg collection? Again, after the egg collection, we keep our patients in bed for an hour or two, to observe if there's any bleeding or any pain. Then after 1 or 2 hours after the egg collection, we send you back home. Bleeding is the most feared, the most important complication after the egg collection. That happens almost less than 0.5% of cases. 0.5% of cases undergoing IVF. Only 1 out of 200 egg collection may end up having laparoscopic surgery to prevent or to stop bleeding, but it's rare. We sometimes observe vaginal bleeding after egg collection, but this complication or this problem doesn't necessitate any intervention. So that's the reason we keep our patients in bed for an hour or two, observe to check vaginal bleeding. The next question is, do you need any tests before coming? Yes, we usually get women's FSH level, AMH level, ovarian reserve parameters, and TSH level to check on thyroid function, sperm analysis, and hysterosapiogram or hysteroscopy or sonohysterography, saline infusion sonography. We need to make sure that the uterus, uterine cavity is normal to undergo an IVF cycle. So these are basic tests to be done. So you can have all these tests done in every country where you like to come from. And the last question, not the least important, but the last. Can I fly to my home country after IVF? Yes, as soon as we transfer the embryos, you can get back to your country. So you don't need to stay in Turkey after the embryo transfer. We had many patients fly back to their country just on the day of embryo transfer or the day after embryo transfer. So you don't have to wait till pregnancy test, or you don't have to wait for implantation. You can get back to normal routine life just after embryo transfer. Okay, so I tried to do my best to answer your questions, to help you out. Please give some more information on the procedure of IVF. If you have more questions, any more questions regarding these issues, please do not hesitate to contact my friends, our colleagues, so that they pass your questions and I'll talk about them at the next meeting. Good luck.